The mother of a man who died of a heroin overdose says her son would still be alive if drugs were decriminalised. It says figures published today reveal more than 3 million people across Wales and England have used illegal drugs in the last year. But ITV polling shows the appetite for drug policy reform remains low in Wales, as Daniel Bevan reports.
Meet Pat. She lost her son Kevin to a heroin overdose in 2017, 2 days after his 32nd birthday. He was one of 2 children Pat and her husband adopted from an early age, but she tells me that Kevin still carried his traumas from his early life with him.
It was a hair's breadth between life and death, and the fact that he was locked away was entirely because of the criminality, the criminal associations, the actual criminality of what he was doing and the stigma attached to that. But I think, if there'd been less stigma and possession for personal use wasn't a criminal offence, he would have sought treatment earlier.
Pat has since dedicated herself to fighting for drug policy reform in his memory, but says it's important to separate drug users from drug dealers.
If this is a question about selling the stuff, especially in large quantities, and supplying it, that I certainly wouldn't shirk from a fairly serious punishment of people involved in that. They don't care how, young or vulnerable the people they sell this drug to are.
The Home Office say they're working to tackle the supply of illicit drugs through relentless policing action. But now an ITV Wales poll has revealed what the public think about the sale and possession of various drugs remaining illegal, but instead being regarded as a minor criminal offence. Cocaine, heroin and ketamine received the least support for lesser sentences, with ecstasy having slightly more. But the drug with by far the most support for criminal justice reform was marijuana, with more people supporting legalisation. Swansea is at the epicentre of Wales's drug deaths. More people die here every year per capita than anywhere else in Wales because of drug overdoses. That's why we've come here to find out how exactly that affects people's lives.
I think Swansea's got more drug problem than what anywhere else has got them.
They are very big, obviously, but which way can you cure it? You can't cure it, it's impossible. They haven't got enough places for people to go to.
Today, figures from the ONS show a rise in the number of people taking illicit drugs in Wales and England compared to 10 years ago. 70% of the people who used any drug in the last year were described as frequent users, someone who uses at least once a month. And if they live locally, then they may find themselves at Adferiad, one of the organisations at the coalface of Swansea's substance misuse issues. Samantha has worked with thousands of drug users over the last 2 decades. She thinks a health-based approach to helping them is the way forward.
Most substance users are regular people with regular families, and I think many of them want to get well, many of them don't want to be dependent on substances. Going to prison, having prison sentences reinforces that negative stigma attached to substance use, really, and can trap people in that constant cycle where they feel it's much harder to break out from.
A sobering reminder of the people behind the statistics. Daniel Bevan, ITV News, Swansea.